very good evening to you and your loved ones. My name is Sarah Otieno, and thank you so much for tuning in to This Is The Day. We are live on Family TV, also live on Family Radio, where the music does the talking. And even as we continue hoping for the best when it comes to the COVID-19 pandemic, let us look at the numbers globally. So if you look at coronavirus cases in the world right now, as the time is right now, the cases are 2.6 million approximately, and the exact number is 2,668,889. And the deaths stand at 186,324. We also have recovered cases, which in this case we will continue to say that it is good news because the recovered cases are more than the deaths that are reported worldwide. And we have 730,000 recovered cases, 987 on top of that. And that, my friend, is good news. When you look at the top countries, the ones that have been ranked the highest when it comes to the new cases, and we look at it from this angle, we have Russia that has recorded 4,774 new cases today. We also have Spain that comes second with 4,635 cases. We have the UK with the 4,583 cases, and we have the US with 1,399 new cases reported in the last 24 hours. Now let us look at it locally. And in our country today, the Chief Executive Secretary, the Chief Administrative Secretary for the Ministry of Health, Dr. Mercy Mwangangi, today addressed the nation, telling us that in the last 24 hours, we had 668 samples being tested, and out of that, we had 17 cases positive, testing positive. Listen in.
In the last 24 hours, we have tested 668 samples. Today, we've been able to share with you a distribution as to the number of samples collected per county, and this will be availed to you. Nairobi still stands as the highest burden of disease county, and so far, we've run 478 samples in Nairobi County. From the samples collected today, we have 17 persons who have tested positive for coronavirus disease. This therefore brings the total of confirmed cases in the country to 320 cases. All the 7 are Kenyans, 12 from Mombasa, 5 from, all the 17 are Kenyans, 12 from Mombasa, 5 from Nairobi. 15 of these were picked by our surveillance teams. And it is important to emphasize the fact that they were picked by our surveillance teams means that these people were living within our communities. And fellow Kenyans, the evidence that is coming in from our testing shows us that indeed local transmission has been established, and therefore the measures that we keep on reiterating on need to be followed.
Well, that is the cases as it stands right now in our country. And later on in the show, I'll be telling you why the color of your toes can tell you whether you have COVID-19 virus, the coronavirus, or not. That is later on, as we also expand on the story of the cases in our country and the state of Kenya. But for now, the governor of Nairobi, Mike Sonko, actually put up and set up some spray booths. And these spray booths have been vandalized, and they are allegedly destroyed by the police officers. And according to Mr. Ben Mulwa, who's the Sonko spokesman, he says that the governor is now being affected with the transfer of power from government and now threatens to have it back. Listen in.
Unakuja kusabotage Governor Sonko. Kama Governor Sonko hako na roho safi ya kusaidia maskini, wateni asaidie maskini.
Sisi kama wahudumu wa matatu, hiyo sanitizing booth ilikuwa inatusaidia sana. Manake customers wengi wakikuja, kuna wenye walikuwa na prefer kuingia hapo ndani kuliko kutumia ile maji ya pale kwa tap na sabuni.
Sasa hii naona ni kuna shida juu watu wanaogea ile dawa tuna sanitize tu, lakini kwa manguo Hii faida tumesikia mpaka iko kwa nguo nini.
This is really the wrong time for people to start introducing politics at a time of a calamity. In the event the numbers rise, as Nairobi is currently leading, Nairobi will be the worst affected of all the 47 counties. So it is time really we focus on how we can partner with each other and ensure that we keep our residents and our city safe. These individuals have introduced pettiness in terms of frustrating not only the efforts of the governor to undertake his roles, but also to appear to take away other functions through the back door that are not captured in the deed of transfer. So the governor is very expressed that in the event they are not able to follow through what is captured in the deed of transfer and what the constitution expects in the event functions are transferred to another government, the governor has no problem at all terminating this deed of transfer. And there is a very clear provision for the same in the deed of transfer that was signed on February 25.
Well, according to Governor Sonko's spokesman, Ben Mulwa, he says that right now Governor Sonko is willing to fight and have back the power of Nairobi County. Let's head over to the issue of free sanitizers that were supposed to be distributed across the counties. That process has already started, with the government working together with Kenya Pipeline to process and distribute 20,000 liters of free sanitizers to each county every week. That process has kicked off, and now we have the representatives speaking about this.
During this time that Kenya is going through this period of real uncertainty, we need to be counted. And we have decided, and we have, through the support of Kenya Pipeline, who we have a very good relationship for, we have a lot of trust in them, and through Diversity, we have arranged to have 105,000 liters of ethanol converted into sanitizer. That, I believe, is equivalent to about 140,000 liters of sanitizer. And I believe that counties are getting 20,000 liters a week. We are able, therefore, to supply 7 weeks to the counties.
Normally, it would be $5 a liter. So you can work out 105,000 liters of ethanol, what that comes to. So it's quite a huge amount.
IRA has also facilitated in ensuring that Kenya Wine will get back the excise duty that they had paid on this product that was to be used in manufacture of alcoholic drinks, but graciously they have donated it to us. And going forward, I think we shall continue facilitating that.
So the more of us join to provide face masks, sanitizer to our public who need it more than ourselves, then we will be able to open back our economy quicker.
Well, this is good news for watu wa mashinani, because finally we will be having free sanitizers. But there is also a downside to this, and we'll be talking about that story and what the CAS for Health, Dr. Mercy Mwangangi, said about the over-reliance on sanitizers. We are live on Family TV, also live on Family Radio, where the music does the talking. Thank you so much for making time for This Is The Day. The WhatsApp number that you can use to contact us from is 0786 316 316. SMS line 20316, and on Facebook and Twitter at Family Radio 316. And let us get talking now. 6 people have been killed from the 10 days of curfew, and this is a result and a report that has been given by the Human Rights Watch that said these cases are allegedly from police brutality. And let us refresh our minds on March the 30th, following some criticism that was from various groups about the mistreatment of Kenyans, and especially in Mombasa, President Uhuru Kenyatta apologized generally about the police using excess force to instruct people on how to conduct themselves when it comes to the curfew hours. Let us refresh our minds on what the president said about this.
I know, especially when we introduced the curfew, maybe in the initial stages there were some challenges. And I want to apologize to all Kenyans, maybe for some excesses that were conducted or happened. But I want to assure you that if we work together, if we all understand that this problem needs all of us, and we all pull in the same direction.
Well, if we all understand and pull in the same direction, then these cases might not be happening. But up to now, from the Human Rights Watch, 6 people have been killed following police brutality. Now, earlier on, we were talking about the CAS, and there's one thing that she said during the press briefing today. So she says, and cautioned against the issue of stigmatization that have been extended to those in the quarantine facilities and also when they are leaving the facility. And she says, her words, contracting the disease is not a crime and being quarantined is not detention nor punishment.
We want to make it clear today that contracting coronavirus is not a crime. All of us have a potential risk of contracting the disease. And that is why we have come up with measures and guidelines to ensure that we are all able to control transmission of this disease. Being quarantined is neither a detention nor a punishment. Quarantine is meant to serve the greater public good in ensuring that we protect our country. We therefore must urge you, fellow Kenyans, to join us in ensuring that we do not stigmatize those who are sent to quarantine facilities, and even those who have recovered from this disease.
Well, the ministry also, through the CAS, warned that there is cases of over-reliance on the sanitizers, pointing out that the use of soap and water is still the most efficient when it comes to controlling the coronavirus.
Today, we are celebrating our local innovators who have put all these different devices in place to ensure that our containment measures are actually useful in flattening this curve. We have, however, fellow Kenyans, noticed a worrying over-reliance on sanitizers. While sanitizers are effective, soap and running water is the best for fighting this disease. People must therefore start prioritizing washing hands and only sanitize in conditions where sanitizing would be useful. And this has been elaborated in our communication and in our guidelines.
Also something that was added is the fact that information and education of the public about the disease will continue to be done by the ministry, also saying that essential services should adhere to the rules to help curb the spread of the virus.
Fellow Kenyans, it has come to our attention that we do require to continue providing education with regards to coronavirus. And today we would like to highlight the issues of symptoms. We have seen and had concerns from the public regarding how the pathogenesis of this disease evolves. In other words, regarding the issue of being asymptomatic. We've noted that there's confusion about it. And fellow Kenyans, we're here today to tell you that this is a new virus and scientists across the world are still learning. However, one of the key things that we need to remember is that, one, the incubation period for COVID-19, which we would infer to be the time period between exposure of the virus to the time when the onsets come about, on average is usually 5 to 6 days. And sometimes in some individuals, according to the evidence that is coming in, this can actually go up to 14 days. And during this period, it is important to note that the people who have this virus within them can still transmit the virus to different people in the community. Secondly, studies have shown us that sometimes you may test positive for coronavirus depending on different time periods. Some people could test positive between 1 to 3 days of contracting the virus, and this is still an issue that is under surveillance in terms of scientists trying to study it to understand.
Well, even as the CAS is pointing out on the symptoms that people face for this COVID-19 pandemic. Now, doctors have warned of a mystery symptom that it has the growing numbers of patients and people changing their skin color. And this is a problem that has been noticed by some of the doctors, and they're calling it the COVID toes. So dry cough, fever, and also the issue of fatigue has been a symptom for this virus for quite some time. But there is also the issue of loss of smell and taste. There is another one though. And this has gone unnoticed for quite some time. The mystery hanging blueness stain. This is stain that changes the skin color, and especially it is noticeable in the toes. Listen.
This is under the dermatologic or skin manifestations category, and some early reports in the medical literature suggesting that it could be as high as 20%. That's based on reports out of Italy. But take a look at these images for an idea of the range or spectrum that we could possibly see in patients with COVID on their skin. You can see everything from bruising to discoloration, ulceration, rashes, hives. The list goes on and on. You can see in some cases a net-like pattern that typically affects the trunk. In the toes or fingers, you could see things that almost look like frostbite. Sometimes there's a change in the skin texture. Sometimes this is associated with discomfort or pain. There are theories about this, you guys, which is that dermatologists have long since known that when people get viral infections, they can have skin manifestations. But these are definitely atypical, and they're getting a lot of attention from our dermatology colleagues. Well, I think in the absence of any other symptom, they should follow it. You know, everyone has a phone with a camera feature on it, so that's a great use for that. You want to take daily pictures. If it's a rash, what we do in the hospitals, we literally take a pen and mark the borders so we can see if it's progressing. Dermatologists now are doing more telemedicine consults than ever. There are apps where you can get a dermatologist's opinion on things, but certainly if you get any other symptom of COVID, a fever, anything else, you definitely want to seek some medical attention. Well, Amy, actually the abnormal clotting pattern that we're seeing in some critically ill patients with COVID may actually be related to these skin manifestations, but we're seeing these microscopic blood clots in arteries, veins, that definitely affects blood flow and oxygen delivery to all parts of the body, and that's what we saw with that tragic case.
Well, from now on, maybe the colors of our toes can tell us whether you have the virus or not. That is directly from the doctors. Now, we've been having heavy rains in our country and across different counties for some time now. And the CS for Devolution, Eugene Wamalwa, has actually assured families affected by these heavy rains that they will receive government aid. As today, the spreading and the distribution of these relief goods has finally kicked off.
Hakuna sasa mahali shamba ilipaki pandei, mashamba, manyumba, manini, kila kitu ilifyekwa.
Prepare for these abnormal rains. What looks so abnormal now is the terrible new normal going into the future because of climate change. Therefore, we must know how to adapt. We must build resilient counties, but also we must change the attitude of our people.
For the private citizens and corporates who may wish to donate but may not have the logistics to go to a slum area, to go to a particular home, to benefit a particular group, that this will be the place for us to bring our donations, our food support.
So we have to do the door-to-door deliveries, which is quite tricky because sometimes you go to a place and there are so many people who are needy, but you just actually had to just fix your eyes on one, and the rest will be like, how about us? You know, so that becomes a challenge most of the times because they are also needy, but it's just that you can't be able to afford to actually give a package to each and every person.
Tunazindua ile misaada ya wahisani pamoja na chakula ambayo imenunuliwa pia na serikali ya ugatuzi.
Well, right now, even as the heavy rains are being experienced across the country, the government is actually doing something. Now, let's head over to the elderly people. And for some time now, they have been complaining on the disbursement of funds. There is one issue, though, and this is according to the ICT Principal Secretary Jerome Ochieng, and he says a lack of accurate data is slowing down the disbursement of cash to these vulnerable groups. This follows actually a High Court restriction for the use of Huduma number to get the contact and information for these vulnerable people. And he is saying up to now, the government has paid out 170 million shillings under the cash transfer program. He also says that the stipend targets 1 million households whose economic situation right now has been worsened by the coronavirus pandemic. Listen in.
Some Kenyans went to court about it. And actually the court pronounced itself that really we cannot go into any other stages of implementation of Huduma number until the matter is determined. So, and we were actually not even supposed to use the data. The only thing we were asked to do is to collect the data and wait for the decision of the court. So this has put us in a very precarious situation in the sense that we do not want to defy the court order. If we really had a platform whereby we are able to authenticate the person with the documentation and with the details that they have, then we will be very sure that actually we know whom we are dealing with in person and we actually have correct data. Then data analysis based on that becomes very easy in terms of distribution, in terms of location and things like that. All those will have been the advantages would have accrued from the use of the Huduma number. It would have been wonderful if we were able to access this data and use this data to manage the COVID-19. It would have been very, very good. But again, that is where we find ourselves as a country. We are obeying the court order, and we will wait for the decision of the court for us to move to the next steps.
Well, according to the ICT, PS is saying they will wait for the court order to see now the way forward. Later on, I will be telling you about this guy who is in Thailand, and he tells us the situation as it is. I can see my friend Douglas Mashira. Asante sana for tuning in. Esi Kimenyi pia na kuona. Martin Dungu all the way from Gikomba. Asante sana for tuning in today. You can also use the WhatsApp number 0786-316-316 to contribute to our discussion. The SMS platform is 20316. On Facebook and Twitter at Family Radio 316. Now there has been a case of rising cases of domestic violence and mental health. And according to reports, most of these abuses are coming from relatives and victims with stress over the lost income due to the shrinking economy and job losses being blamed to the spike. Now, the CS for Health, Mutahi Kagwe, yesterday talked about the hotline number that has been given for anyone who feels like they are mentally disturbed because of the COVID-19 pandemic. Let's remind ourselves.
Gentlemen, fellow Kenyans, in times such as this, we have to be alive to the effect that COVID-19 management measures, what these measures have had on our people. We are particularly concerned about mental health. Towards this end, we have established a psychiatric and psychological care help framework over this period. If you feel distressed and needing counseling or psychological care, please call 1199 and you will be attended to. For any inquiries on continuity of psychological care or psychiatric emergencies or crisis, please call our hotline, which will be distributed to the media.
Well, it is also feared that the country might be experiencing increased numbers of suicide cases. And to understand what is happening to our loved ones and how to help them, we earlier spoke to Nancy Kabiru, the founder of Hisia Psychology Consultants, and she just told us on how to pick on the symptoms when someone is not mentally stable. Listen in. So, hello, Nancy. How are you doing?
Very well, Sarah. How are you?
I am fine, thank you. So on the issue of mental health,
yes,
the cases have been increasing in the last few days. So let me ask you, from your point of view as a psychologist, what are some of the signs that we can pick up from a mentally disturbed person?
You will notice that they no longer enjoy activities that they used to. They either are oversleeping or are unable to sleep well through the night. Their eating habits have changed, so they are overeating or they are not eating at all.
Okay.
You will notice that they have anger or mood issues. They are unable to regulate their moods. You say something small, then someone gets angry at you.
Yeah.
Then they are unable or they choose to isolate themselves. They don't want to make any emotional connection with someone. They'd rather keep isolated.
Okay.
And then they have they have an inability to complete a task. So if you're supposed to do 1, 2, 3, 5 things, they are unable to complete that. They start becoming forgetful. Yeah.
And
of the side.
All right, and you talked about the issue of not willing to make connections with other people.
Yes.
Does this also cut across spouses or even the children and all that?
It cuts across everyone because you will realize if you are talking about children, the child starts becoming shy. They retrogress. So the stages they had already previously passed, like wetting the bed or being able to feed themselves, they are unable to do that. They start wetting the bed. They all of a sudden don't have the interest to feed themselves or even so it cuts across.
All right. And then when we're talking about spouses, and right now we've seen the cases of domestic violence also increasing in the past few days.
Yes.
So how am I as a person, as a partner, how am I supposed to support my partner, especially during this time of COVID-19 and people are staying at home?
Well, you know your partner, you know how they like to communicate, what their language of love is.
Yeah.
So when they are off that, when they are not communicating as they used to, then there is a problem somewhere. When their mood is on the high, like they get angry, or they don't want to eat, or they really want to eat a lot. They keep getting offended if the kids come to ask a question. You can tell that they are going through stress or they are going through a mental challenge, like depression is starting to kick in, and you need to step in and help them or give suggestions such as let's go or do an activity with them that will help reduce the stress or the tension within the body.
All right. And will all these help to maybe evade completely or stop domestic violence from happening?
It can reduce. It can reduce the chances of domestic violence being on the increase. But we always tell someone, if you're going through an abusive relationship, your first responsibility is yourself. Your second responsibility is on the people who require your support. So if your wife is physically abusive, you need to protect yourself, then you need to protect your children.
Wow.
And how do you do that? You need to speak to mental health counselor. Maybe you speak to your church group or someone who supports you in your social circle. If it is aggressive and it is way beyond your control, you need to report that to the police so that they can intervene. Your safety as an individual is very, very important, even before you go to helping the person who is violent. So look out first for your safety. Don't underestimate the chances of you getting hurt or it escalating into something major. Then second, the abusive person, are they constantly abusive or is it something coming on and off? When they are not abusive, are you able to pick up on that topic and tell and communicate how it hurts you or it affects you? And if you are not able to communicate that, who do you think this person can listen to so that they can see? You can suggest them speaking to a mental health support. If you're a couple, to your best maid or to your pastor or your church support group, it is important to ensure that you have social support to be able to deal with issues that are affecting you. But overall, your own wellness is most important.
All right. And we've seen the government doing and putting some measures on the issue of mental health. The 1199 dial hotline, landline that they're using right now. But someone might feel a bit laid back to call these numbers and even to seek for help.
You may feel, because someone who is in an abusive relationship, first of all, they feel helpless.
Yeah.
So we have to sympathize with them. They feel caged. They feel it is, sometimes they blame themselves. They think they are in that situation because of their own fault. So they are not able to think or to even make that initial step.
Okay.
Secondly, if it is violent, they are not safe. So even calling, making that call, someone could be listening and you may adjust them. So that could hold them from talking to someone. But you can let a family member or a close friend dial in for you to, so that you can be helped. So if you are unable to call, ask a friend. We have different modes of communication: WhatsApp, SMS, via call, whichever mode. Ask for help, but keep quiet in an abusive relationship.
Wow. Thank you so much, Nancy, for enlightening us on that. And I hope you're keeping safe.
Yes, I am. I'm very much at home, isolated. Keeping social distance.
Wow. Thank you so much, and thank you, and have a beautiful evening.
You too, Sarah.
Well, that
Thank
has
you
been
too for
Nancy
hearing.
by founder of Hisia Consultants, psychology consultants there. And we have Vincent Mulinge, who is talking on that point and saying, I think everyone is currently stressed and we should be strengthening each other because COVID-19 is affecting the whole world. And good news is that it is not a permanent situation. That is good news there. And while it's not only in Kenya that people are battling the issue of stress and COVID-19 and even the lockdown, also in Thailand, and we will be talking to one guy. His name is Vinny. Vinny is an Italian. He works in China, but right now he has been forced to remain in Thailand, where he went for a vacation just before that country was declared into a lockdown. And he tells us how the situation is. So listen to what he says.
Abariagioni, Sara. So you can see this is the situation in Patong Beach. Patong Beach is in Phuket Island in Thailand. And you can see that here behind me there is almost nothing, almost nobody. The sea is of course always amazing, very beautiful. You see behind me Patong Beach, the sign. Usually here it will be so crowded that you cannot even walk. Now I will change camera, I will show you the situation in Bangla Road. Bangla Road is one of the most popular roads in touristic roads, touristic meeting points in Patong Beach. You can see here, this is Bangla Road, and is absolutely deserted. Normally here there is so many people that you cannot have a chance to walk at night and even actually during the day. So this is the situation. I want to show you the other side, and I want to show you some images of the side, the sea walk. This is all the road that is just running beside the sea, and normally all these places are very much open and very much crowded. You can see from the side of the beach there is nobody, and the government in Thailand ordered to stay at home as curfew starting from 10 p.m. to 4 a.m. every day. And actually Patong Beach doesn't have many cases, and we believe that in about 14 days Patong should start opening again. You see even tourists practically doing nothing during the day. Now we are going around, and just to show you that all the town is in the same situation. It looks like a scenario of war. It looks like something similar to the day after an atomic bomb. It's absolutely scary to see Patong Beach in this situation, so totally empty. I believe nobody, even Patong people, ever has seen something like that, like so empty, this town so empty this way. Italy right now is about 500 people dying every day, and I want to say, you know, they are really mothers, fathers of family, brothers, sisters, wives, husbands, and they are not just numbers. So you have to consider the quantity of people you can see in any big pub of Thika Road dying in Italy every day. I don't know when China will open the borders to the foreigners again, because in this moment China has properly closed the borders, and so foreigners cannot enter even with Z visa. Z visa is the kind of visa you need when you have a job there, the visa you receive when you have a job there in China, and of course consequently the residence permit. So I regularly have a residence permit, but still I cannot enter China. This is one of the measures that helps to prevent foreigners to bring back a virus to mainland China, and these are the measures that I hope also Italy will consider with so many foreigners we have. That's scaring. You have to imagine that the places that I'm about to show you are crowded like I don't know, the area of Commercial in Nairobi. 12 p.m. Commercial Saturday afternoon. That is what you have to imagine. So seeing Patong Beach so empty is something really scaring and something really shocking.
Well, that is the story of one Vinny. Vinny is in Thailand, and up to now he does not know when he will go back to his workplace in China or even see his family members in Italy because of the COVID-19 pandemic and the lockdown in that country at the moment. So it's not only in our country, but at the end of the day, there is hope. Now, let us go to the US, and right now, despite the fact that they have recorded over 40,000 the death toll that is as a result of the corona pandemic, these numbers might actually be higher, and are considered less because of the shortage of testing kits. Now soon, the first responders and also the healthcare workers will receive the first FDA authorized at-home test kit. Now the FDA Commissioner Dr. Stephen Hahn discussed on this home test.
So this new test is an at-home collection test for a diagnostic. That is a test that would diagnose the presence of the COVID-19 virus. And this is a test where it's going to focus, LabCorp, this company that's developed this, is going to focus first on frontline healthcare workers and first responders. Those with symptoms can go online and fill out a questionnaire. The questionnaire will be reviewed by a healthcare professional, a licensed physician, and if appropriate and consistent with the CDC guidelines, a package will be sent overnight with a swab and a tube. It's very easy and safe to perform. Our data show that it's as accurate as having it performed in the doctor's office or in a clinic. They can perform the test, put it in the tube of saline, and overnight it back to the lab, and then get the results thereafter from LabCorp. The at-home test is certainly part of it, and FDA has issued 59 emergency use authorizations for tests, 4 of which are the antibody tests, and the rest are the diagnostic tests. We have over 300 developers who are working with us to continue to expand that capacity. The other thing that it's really important to know, and this has been mentioned several times, and we've had calls with the governors about it, there is unlocked capacity in the country. We're working very closely with the governors and the state public health officials to make sure that the adequate supplies and the information about where those tests are available are made known to folks so that they can actually unlock that capacity. And we believe that based upon that information that we could double the number of tests that are done in a very short period of time. I mean, you've seen Dr. Birx and Dr. Fauci talk about this on the podium. That could be done this week if the appropriate identification occurs at the state level, and then the supplies are there for them. And so this is every day working with the states, unlocking that capacity, getting the supplies where they're needed, and actually informing the state public health officials about what alternative supplies are available. And we've issued a number of flexible policies to allow different swabs and different agents to be available, and we are disseminating that information very quickly to the states.
Well, that is some good news there. If we'll be having home test kits for COVID-19, then it is good news, and not only for the United States of America, but also for the whole world as a whole. Now, there is a patient that recovered from COVID-19. Her name is Edwina Kane. And since she was let out of the hospital after testing negative for COVID-19, totally recovering, she has always been thankful for the doctors. And after 10 days of staying home, she finally had to reunite with the doctors and those that took care of her through a video call. It was a happy time for her, because if it's not for them, then she would not have survived the COVID-19 pandemic.
I said, and when I walk out here, I promise you, before I leave, I'm gonna dance. And I kept my promise.
First couple of days on a ventilator, she was like any other patient, very critical. We were watching hour by hour, seeing, but then towards the third day, she just started to improve, and she improved dramatically. Day 4, day 5, she was ready to get out of the ventilator, and that was a miracle.
I was just feeling like a little icky. I didn't think too much about it. It was just like a little off.
She was really critical when she came in. A mechanical ventilation with a tube down the throat was inevitable. There was no way that we could try anything else. We had to rush in, take the tube out, because otherwise she was going to take it out of herself. Her energy basically took the whole entire unit. The medical staff, the nurses, the medical assistant, they all got to be friends with her.
You guys actually taught me faith. Like, there's hope. And I don't even know how to thank you enough.
The thing is that the whole hospital needed a moment like that. We were being really critically hit by a lot of people dying and very sick, and we needed a motivation.
How are you doing?
Wow, you look wonderful.
Thank you, it's because of you.
You did go home.
I made it.
Oh, wow, that I didn't know, but that's great.
We really thank God for that good news, and every day we look forward to recovered cases. Now, Remy Kipchirchir, thank you so much for tuning in and saying you're glad to be tuned in to This Is the Day as you listen to the news roundup. As a matter of concern, we need to take care of our lives. We need to protect and make sure we are able to address the issues to do with mental health. Otherwise, it will affect how we relate with other people. Asante sana for tuning in today. Also, Sarah Wanaivasha, thank you for tuning in and saying that discussion was really eye-opening. And also in Thailand, we can see that the situation is not very much different from Kenya. Kama wazungu can handle it, then we can also handle it. That is positive news there. But before I leave, there is some information that has been passed across by the Communication Authority of Kenya through the Acting Director General Mercy Wanjau. And they have raised a concern over the cases of fraudsters using the name of Communication Commission of Kenya. And these are actually the predecessors of CAK, and they're cautioning subscribers because they have... These people are actually telling subscribers that they have reached a maximum number of SIM card allowed per subscriber, and they are calling out on every person to be vigilant. And if in case you hear of these cases, then you need to be on the lookout and contact the Communication Authority of Kenya through some hotline numbers that they have given out, and I will share that directly to you. So some of the information actually that the fraudsters would ask for include your ID number and other important details. And when this happens to you, it is right that you can communicate to the CAK through the number 0703 04 2700, or also through the number 0730 172 700. We all need to be vigilant, because this time, as people are staying at home, others are using this opportunity to get money from other people illegally, and through communication and through your phone, that is one of the platforms. So we just need to be on the lookout and take care of yourself, continue keeping safe and keeping your distance, and adhering to the measures that have been put by the Ministry of Health. Washing your hands often. Remember to do that while singing happy birthday twice for 20 seconds. Thank you so much for tuning in to This Is The Day. My name is Sarah Otieno.